Hi, hope all are doing great. If you look globally, people are always complaining in their daily routine about their own stomach. As I can't digest the food what I eat, I have stomach bloating, I have acid reflux, I have stomach pain, I have constipation, this, that, etc. But it is not always about the stomach. It is only about the lifestyle and the food habits what you follow. Yes, today's topic I have taken to discuss with you all is gastric ulcer. What is ulcer? Ulcer is nothing but wound. If the same wound is inside the stomach, then it is known as gastric ulcer. This ulceration can even extend inside the intestines and cause severe abdominal pain. Why does this happen? Usually the stomach secretes strong acid to digest the food and break down the food what we eat. And if we are not eating when you are hungry, that is when the acid is ready for digestion, that time the same acid can erode and ulcerate the inner walls, resulting in ulcer. And chronic ulcer may lead to intestinal bleeding, where the blood oozes out from the inner wall of the intestines, causing too many damages as well as blood loss, resulting in chronic anemia. The symptoms of ulcer could be stomach bloating, pain mainly in the upper abdomen immediately after taking food, and sometimes indigestion, frequent belching, which may lead to nausea or even vomiting. And the ulcer patients can feel fuller sooner than the normal and result in chronic GERD, that is gastroesophageal reflux disease. What are the causes or the reason behind ulcer? Number one is not maintaining proper healthy eating habit, that is in accordance to the circadian rhythm, which I have already spoken about in the previous video. Number two, taking spicy foods that one gets tears out of the spice what you eat. Number three, because of taste, some may go for or choose the foods which are high in gastric. For example, potatoes, plantain green, yam and even cooker rice increases the gas, that is a vata dosha, causing the ulcer, which is the basic reason said in the ancient scripts for the ulcer problem. The next major thing is no one is taking their own time to have their food. At least you take 20 minutes to have your food nicely bitten and chewed inside, because I see a lot of people just keep swallowing the food and running to the office or school or colleges. So that is the main thing, because half of the digestion takes place in the mouth, where the enzymes, amylase, lipase, protease help in proper breakdown and metabolism of the food. So don't forget to at least have your food for 20 minutes. The next thing is constipation. For some reasons, some may avoid the public toilets even when they are in urge to motion it. So that is not the thing you should do, because chronic constipation, the excess gas fills inside the stomach, causing ulceration and resulting in severe stomach pain. And the other thing is mind disturbances like chronic depression, chronic stress can also result in too much of acid secretion inside the stomach, causing ulceration. For example, if you're shouting to a person out of your anger, then it is not a problem for them, it is a problem for you, where excess acid keeps the intestines, resulting in wound, that is ulcer. And last but not least, persons who travel a lot and they don't hydrate themselves can end up with increased body heat, that is a pitta dosha, resulting in ulceration. Chronic or severe ulceration can even result in intestinal bleeding, where people may get vomiting in black color, which means the iron inside the blood causes the nature of the vomit to be in black. And few may have their stools to be in black, where our own intestinal blood is digested by our own stomach and expelled in the motion as black colored stools, which is confirmed with occult blood test. What are the preventive methods of ulcer? Number one, maintain proper time for eating and sleeping in accordance to the biological clock. Number two, avoid spicy foods and gastric foods, as this may cause excess acid secretion inside, resulting in ulceration. Number three, reduce spicy foods and include alkaline foods, because the spicy foods increases the acid inside the blood and cause ulceration, whereas the alkaline foods try to heal and protect the cells from their damage. How could you prevent from ulcer? Number 1, maintain proper and regular timing of eating and sleeping in accordance to the biological clock. Number 2, avoid spicy foods and include alkaline foods, that is amla, lemon, pomegranate juice, etc. are rich in alkaline tea to heal your intestines. Number 3, avoid all gastric tubers, even cooker rice, since gas inside the stomach causes ulceration. Number 4, try to avoid deep fried items and go for steam cooking process, since in dry foods there is no moisture, it might erode and irritate the inner walls of the stomach. Number 5, avoid stress and anger, which could increase the acidity inside the blood, causing ulceration, for which you can go for meditation, pranayamam, etc. Number 6, try to limit your caffeine, coffee, tea, colas, or what are the beverages whichever rich in caffeine. And if you're a smoker, then try to avoid smoking. What are the home remedies for ulcer? You can try a glass of milk mixed with 1 tablespoon of honey to it, mainly at the night, because once you sleep, you are in starvation for almost 8 hours. So that time, the acid couldn't irritate and make your ulceration severe. Number 2, you can go for rose-made kulkand, which is readily available in the market. You can have just 2 spoons in the morning and 2 spoons in the night. Number 3, you can take amla juice daily morning in an empty stomach. Number 4, you can go for a glass of pomegranate juice made adding the inner thin layer, that is a white layer inside the pomegranate. You can just also mix into the seeds of the pomegranate and make juice, filter and drink. Because since it is rich in alkaline, the intestinal layer will be strengthened and get rid of ulceration sooner. And finally, be grateful to you, yourself, family and friends, and last but not least, your own body. Thank you.